Hey everybody, what's today? Today's August 13th, I think. What is it, Friday the 13th? I think it is. And it's, I guess, day, what, 20, it would be 21, 22, 24, day 24 of a recovery from TIF and Hiatal Hernia. I think I left a video on day 20, or posted a video on day 20. Unfortunately, quite a bit has changed since then. Not to discourage anybody that's out there from getting a TIF or hiatal hernia, but I'm almost a month out from surgery. I've been eating a soft food diet, as I mentioned in previous video: oatmeal, eggs, ground meats like turkey and chicken, mashed potatoes, cottage cheese, fruits, soft fruits, just berries, melons, stuff like that. So I've been eating strawberries and peaches. Peaches are soft in the can, no skin. But I've had worsening of symptoms. For me, again, as I mentioned in previous videos, I haven't had heartburn, but I've had throat burn, way up, here above the clavicle area, and that I haven't noticed really, but water brash or excessive saliva, nausea, sour taste when drinking water, the gas pain I've mentioned in previous videos has improved, but I still get, I guess that's more of a, not maybe a gas, I don't know, maybe it is gas, but it's like almost like a lump in my throat, which I think is common. I've had a little bit of trouble with dysphagia or trouble swallowing. I've had that in the past too, but the symptoms have also worsened. I didn't do anything differently. I was following the rules, the diet guide. I started to eat a little bit quicker than I normally would, maybe. But it didn't feel like I couldn't handle it. That was, again, let's call it day 15, 16, something like that. And felt fine eating eggs and, like I said, the stuff that I was eating. But it wasn't until around day 21, maybe it was the evening of day 20 when I posted a video, where I started having symptoms again. And the fact that they've worsened is concerning. When I talked to the doctor, my hiatal hernia repair doctor, on day 15, he, as I mentioned, didn't blink an eye, didn't have a concern. It's normal. It can take 4 to 6 weeks for recovery. Luckily, I have two doctors kind of in this regard. It's maybe an advantage. The TIF doctor kind of said the same, but he was talking about, unfortunately, that's why I'm about to go into the grocery store, and it's very, very, for me, disheartening to have to go back to the week 2 diet, which is the liquid diet, essentially. It was a hard 14 days to get through the liquid diet. At least I won't have to do it that long. It doesn't sound like. I hope, fingers crossed, but that's why I'm here. Why I'm posting a video is I've had a worsening of symptoms. He's thinking it's a result of the inflammation. They're relying on inflammation and scar tissue to, seal and hold and repair and fix and get the new valve to work like it's supposed to regarding the TIF. He said, absent of fever, doesn't think I've had any major complications, but they want me to go back on a liquid diet, essentially, for a couple days, which today's Friday, and I'll probably go do this the rest of today, as well as through the weekend, and maybe it's like a Monday, and then see how I feel. The hiatal hernia doctor talked about giving me some steroids if I didn't improve. The TIF doctor mentioned what he called the GI cocktail, which is apparently a mixture of Maalox, lidocaine, and a liquid Benadryl. The pharmacy has to make it, and they don't even know the ratios, so they have to get clarification from the doctor on how to make it. So I'm waiting for them to do that. Apparently something about taking up to 4 times a day, usually before meals. It takes 5 to 10 minutes or so, really acting fast to calm the esophagus or whatever down, so that I can eat, I guess. I don't have trouble eating. I don't have usually in the morning, I wake up and I forget to mention that. I wake up in the morning and I do feel, I don't know if it's a gas or if it's burning. You know, I've had these symptoms for so long, it's not normal. You know, and before I wasn't waking up, I felt, as a phlegm, you know, I don't know, but it's just like it's not a very good feeling in the throat. And I wake up with that. And then I eat, and this morning I had cottage cheese and peaches, and first several couple bites just kind of, and I don't think they're overly large. I think they're pretty small, but again, maybe I'm overdoing it, and it goes down, it kind of just hurts, dysphagia, trouble swallowing. But again, it hurts more so up here, not down in the stomach area. A little bit where the esophagus empties into the stomach, but not a ton. So that's another symptom. But anyway, I don't have trouble eating really, I don't think. Been able to tolerate a little bit more food too, but maybe that was a problem. Maybe my stomach wasn't ready. But I wasn't getting any clear signs of a problem that I guess maybe that's a clear sign with, so a little bit of trouble swallowing and water breath, nausea, sour taste. Maybe those are the signs that I should be eating less. I don't know. But that's not what they said. They essentially said go back to a liquid diet. Which, is disheartening. I've lost another couple pounds, even though I've been on a soft food diet. I think I've lost probably a good 12, 13, 14 pounds now. Depends on the day, how much I eat, how active I am. The more active you are, the more calories you burn, the more food you need, and I can't eat any more food. So it's not like I can just, do that stuff. I thought about taking a weight gainer, and I have some, but I didn't take it because it's got creatine, and I don't know if my body should be having that right now, so I haven't done that. And I could ask the doctor, but I'm just also need to be patient and just do what they're saying. So anyway, complications. I'm very disappointed right now. Hopefully things work out, but I'll post another video probably on Monday. I go back to see the doctor coincidentally anyway, or the nurse practitioner on Tuesday, 1 o'clock or so, and hopefully by then I feel a little bit better again and my symptoms have subsided. But if not, they're gonna order an esophagram, the x-ray I guess, to see, and hopefully excuse me, hopefully I don't have any complications. If I have further complications, I guess I'll have to deal with them. What else am I supposed to do? But what really gets me too is, I guess, that not only that I have a return of symptoms, but I have a worsening of the symptoms. So I was working around the house and doing what I call very, very, very light home improvement projects. Taking off, not touching the door, but taking off the one hinge off of a door, and then another hinge off of a door, just to paint them. We'll spare you the details. But not lifting more than 10 pounds, because I was given, you can go to 10 pounds now. It says that in the book. So all I was lifting, the heaviest thing I was lifting was a drill, with power drill, which weighs less than 10 pounds. And then just drilling in and out. Could that have been a problem? I suppose. But again, I don't think that, if somebody was a carpenter and they were on modified duty for the surgery and all they were asked to do was use a power drill, the doctor would say, oh yeah, sure. And that's not violating the 10-pound restriction. But, core engagement. Anyway, that's all I've done. I work on the computer, so I haven't done anything. I haven't exercised. I walk, which I don't call exercise, but no offense to anyone that's what your exercise is, but I haven't done push-ups or pull-ups. I haven't done anything other than walk. That's all I do, is walk and work on the computer, largely. You walk around the house, and then again doing those home improvement projects, taking those hinges off the door frame, painting a handrail, sanding, you know, and nothing that causes me any issues that I notice. But anyway, that's the most recent update. It's disheartening to go back to the liquid diet, but that's where I am right now. When I would imagine, hopefully they'll call me by the end of the day. I don't know if this pharmacy is open on the weekends, but I'd like to start this cocktail before the weekend comes, along with the liquid diet, so I'm not on a liquid diet for another week. That was hard enough for 14 days. To have to go back to it for more than 3 to 5 days would be a challenge. You know, at first I thought, oh, this is not that bad, but you know, it's not real food. Liquid, I mean, it's just not fun to drink something. So again, I'm not a positive, optimistic person, and just to be real with everybody, in my experience, I do not want to do a liquid diet. And that was one of the hardest parts, was drinking liquid as your food every day and trying to make it as tasty as you can. If you like ice cream and you don't mind that stuff, you're going to be fine. But for me, I want to eat food. And getting to that day 15 and eggs and cottage cheese and ground turkey and stuff like that was great. But for me, I have to go back. So with the medication too, it is what it is. So anyway, here I go into the store to get that stuff. So it's frustrating, but I'm doing what I'm supposed to do. So I'll keep you posted and updated more frequently now that I've had a setback. If I don't post any sooner, I probably will try if I remember to and I'm not frustrated, but it has affected me very significantly. I'm going through some pretty major depression right now because, you know, the whole reason I did this was to have no symptoms, or at least a significant reduction, you know, and now, like I said, it's worsened. I felt, thinking back, I had some tough days prior to surgery, some very tough days, and some days prior to surgery they were worse than now. But the fact that, you know, when I was on a vegan diet and stuff like that, I was having fewer symptoms, you know, and it was tolerable. I was almost used to it at a point. And then I have days where it's really bad and I'm crying and I have to, oh God, I have to go through the surgery. I can't take this anymore. And now, again, I'm crying. I'm like, I just did the surgery. What am I supposed to do now? So I'm honestly, I'm crying and disappointed because I just want the symptoms to go away, or at least you know, when I drink water, that it doesn't taste like soap and it's sour, disgusting, and that I don't have water brash constantly. And I think part of that yuck, sour, disgusting taste is swallowing the water brash, which I think is more significant. Right now, it's not bothering me. Again, it comes and goes. But the duration, the frequency, and intensity of the symptoms have increased. Not, you know, by a factor of 10, but again, it's not improved on what I at least felt or believed, hoped, prayed that they would be reduced after the surgery at a minimum. And they're worsening, which is, it's just hard. So it's tough. I'm fighting. I'm not going to give up. What do I do if I give up? But it's just it's tough. So my advice again is be very cautious and follow the book, follow the diet guide, not just what to eat, but how quickly you're supposed to eat. I think I was, and I don't know, did I do it myself? I don't know. There's no way to know. Did I eat too fast? Did the quantities increase too much? I was hungry, so I asked. They gave me permission to eat more, drink more, protein shakes and stuff like that, so I did. And I didn't notice a problem, but now I have. And I don't know what happened. But I'm going to, you know, again, follow what they say. And if I have to be even more strict, so be it. And if I continue to lose weight, as depressed and upset and debilitating for me personally as that is, I guess I will do it. I have no other choice. That's been hard. It really has been hard on me. I've lost a significant amount of weight, and not just the weight. My body has significantly changed. My muscle mass is gone. And I kind of expected it. Like I said, I think before, I just thought it'd be more gradual. But, you know, I just want to be normal. I knew this was going to happen. It's hit me harder than I thought it would. I knew it was going to bother me. It hit me really hard. And I didn't know that it was going to hit me so hard. But I'll keep you posted again as I go forward and update you, so you know what I've gone through. I'm more of a, not a day-to-day account, because I haven't done it every day, but at least you know what I've dealt with, and maybe what to expect. And then you know, I've seen on YouTube some goods and bads, but I see a lot of goods, and every week I feel good and I've recovered, and you know, so on and so forth, and I haven't. So and I'm almost a month out. I was hoping, again, this was a 42-day process, and maybe that was stupid of me, that I should have thought it was, maybe there was going to be complications, and it was going to be 6, 8, 10, 12, 24-week process, because they tell you, but you know, is every person's body textbook? And that's what the books, I'm sure, are based off of. Averages or textbook, this is what we expect. But I did a hybrid procedure too, so they probably don't have a lot of information on what they did for me. So, all right, that's enough. Talk to you guys soon.